Mark Woods. I'm the Senior Nurse Administrator for Eastern State Hospital in Lexington, Kentucky. I'm also an MSN student at EKU in the NSC 890 program. This is my integrated review on suicide and things that we as nurses can do to change our practice. Suicide, the first slide, one of the slides I've got is Healthy People 2020. It talks about it being we are charged as clinicians to reduce the suicide rate. It is a leading health indicator, which is, they've identified it as a significant problem for us to focus on. 2012, the Surgeon General also came out and met with National Action Alliance for Suicide Prevention and also noted suicide as a serious problem with 4 areas or directives for treating it. The 2 I want to focus on is timely treatment and improving our knowledge through research and practice. Give you a little bit of statistics that is associated with how serious the problem is. It's the 10th leading cause of death in adults 18 to 65, 38,000 suicides in 2010, a few others, about $34.6 billion in medical and work lost cost in 2010, and one significant statistic, 10% of primary care patients with depression actually attempt suicide within 5 years. So study 1, the first study that I looked at, Brown, Tenhav, Henricks, Z, Hollander, and Beck, took a look at the emergency room setting. It had a sample size of 120. They administered CBT, cognitive behavioral therapy, in an effort to reduce suicidal ideation and suicidal attempts and depressive symptoms. It was successful and very effective at preventing suicide reattempts. Study 2 we looked at actually broadened the population that we were talking about. It's Bateman, Hansen, Turkington, and Kingdon of 2007. It had a sample size, of 90. Took a look at the community outpatient side of things with a focus on schizophrenic patients, which had an average of 14 years of actually having the diagnosis of schizophrenia. They also gave them CBT, or cognitive behavioral therapy. They saw it was very effective at reducing suicidal ideation and depressive symptoms. So this study broadened the population that CBT, or cognitive behavioral therapy, is effective with. Study 3 was an emergency room setting. They took a look at the specific parts of cognitive behavioral therapy, and they identified negative problem orientation and impulsivity, carelessness style. And there are various problem-solving skills built into CBT, but these are the 2 that they pulled out, saying they were most significant at reducing suicide. Study 4, Watts, Newby, Mutin, Andrews of 2012, sample size of 299. This was a primary care setting where persons coming in with a depression diagnosis, they gave them or provided them with cognitive behavioral therapy, but over the internet. So provided us with some new data supporting the use of cognitive behavioral therapy in a very creative way with very minimal oversight by a clinician. But it was very successful in reducing suicidal ideations. So we've had a significant response. So to synthesize some of the information or the body of literature, we have a significant response to CBT improving suicide attempts and suicidal thoughts, which are closely related, or suicidal ideations. A broad population data that's becoming available. This is kind of a new thing. Specific aspects of CBT most effective for reducing suicidal attempts, we already know that now. So we have 2 major pieces that we know are responsible for that. And CBT is not new, but we have studies now that are showing us new ways of providing it, which is really kind of exciting. And we have a true need to hardwire treatment modalities for suicide prevention aside from medication. So how does this affect our practice? Well, Healthy People 2020 said reduce suicide rate in the primary and do primary care screenings. This would provide all of that. What I would suggest the nursing practice change be is in the primary care setting, all primary care patients would be screened for suicidal ideations. Nurses would develop or take part in the development of creating an internet-based CBT training that focused specifically on negative problem orientation and impulsivity. This would give nurses new direction and explain, and we would give nurses direction on how to engage their patients in accessing this new cognitive-based therapy. Thank you so much.